Good morning, ladies and gentlemen. Welcome to our International Health 2.0 conference. It is so great to be here. It is so great to see you all. Quick question. How many of you have been to this conference before, whether here in Las Vegas or Dubai? Show of hands. All right, we got a handful. Welcome back. Not your first rodeo. I like it. How many of you, then I'm going to see a lot of hands. How many of you, this is your very first time to Health 2.0? All right, fantastic, guys. My name is Melissa. I will be your MC for the next few days on this journey with you. I have been emceeing this event for the last couple of years now, and I can tell you it is just a fantastic event. Every year I come out with just so much new knowledge and insight, some great connections made, new friendships, and it's just a really wonderful time. And hey, the food's good too. So you are in for an awesome couple of days. We're so glad to have you here. Want to remind you, of course, one of the many wonderful things about being here in Las Vegas is taking awesome selfies. And besides the $1.99 buffet that you can, for some reason, still get downtown, is maximizing your exposure here, right? Whether you're going to be receiving an award, doing a keynote, being part of a panel, we encourage you to post all of it and share with your colleagues and friends back home. And we encourage you to please use the hashtag health, the number 2, CONF, especially on LinkedIn, where I know most of you are. And you know what else is great about this? This is a great way to show, especially some of your spouses at home, you really are at a health conference in Las Vegas, right? It's not just a health conference in Las Vegas. You're actually here. It's going to be your proof. So, our March edition has a well thought out and carefully picked agenda that promises to delve deep into the latest trends, technologies, and innovations in the healthcare sector. Expect a series of keynotes, as we said, panel discussions, and fireside chats led by some of the most influential leaders and innovators in the industry. For this, we are extremely lucky to have the support of our flow patterns and our bronze sponsor, Zani's Health and Fitness. A huge round of applause for them. Are you at Zani's? You know what? I don't think you're coming up just yet, but I want to give you a round of applause right here. Our bronze sponsor. We are going to have you up soon. With this, I would like. We're going to do just a quick, speedy networking. And again, you're going to have lots of opportunity to chat and connect, I promise. But real quick, let's do a little icebreaker. I'm going to give you 2 minutes. Turn to the person next to you, say hello, talk about where you're from. Have fun. Go for it. Make a new friend. All right, guys, we got about 15 more seconds to wrap it up. Tell your new friends that you will talk to them soon. All right, great. Guys, want to remind you if you do need to run to the restroom, want to grab some water, we have easy access right here. I have never been this close to the lunchroom. I'm so excited. And you will be too during lunchtime. So with this, I'd like to begin a round of engaging sessions. I'd like to remind you again that you can catch up on the Health 2.0 conferences happenings on Twitter, Instagram, Facebook, and LinkedIn. So let's get to it. In a landscape where the quality of healthcare often correlates with financial wealth, our first session aims to bridge the divide, ensuring that everyone, everywhere, has access to the best medical care without the burden of exorbitant costs. Please give a huge round of applause for our first session's moderator, Livia Mitchell, founder of Live Speaks, and our esteemed panelists.
Affordable health care is a hot topic, very hot topic. From knowing that your child may have cancer and wondering if you have to go to the Jude's Hospital, to knowing that your grandmother might need an assisted living and knowing that without benefits, she may not be able to pay for it. Affordable health care is a hot topic in America. It is my pleasure to call upon my panelists. They are the best in their industry, and it is my honor and a blessing to me to call upon my esteemed and loving team. So please help me welcome. I have to make sure that I I don't have my glasses, but I think I can do this, right? My first panelist is Jeff Hutchinson, MD. He is the CEO of Weight Alliance. Yeah. My next family member is our Dr. Adem Singh. Please help me welcome her. And she is the founder and CEO, Sunny Therapist. Okay. Next, we have our wonderful Ann Carr, and she is a board member of Common Courtesy Inc. Please help me welcome her. And we are going to round this out with Dr. Dale Holly. He is a physician, a partner physician, board certified gastroenterologist, United Digestive. Okay. This is my favorite part. We call it the thrill and grill. So we're going to ask questions, and our panelists are going to answer your questions. So we are going to start understanding the concern with healthcare. What do you do, and how does it lessen the cost of healthcare, Miss Ann Carr?
Me? Okay. Hello. How are you? Should I sit down or stand up?
Whatever makes you
I'll
comfortable.
just sit. Um, I'm so excited to be here. My name is Ann Carr, and together with my husband, Bob Carr, who's speaking tomorrow, we started a nonprofit a number of years ago, and the name of it is Common Courtesy. And what it is transportation uh, for anyone who cannot or should not drive. And to date, we've done over 700,000 rides to hospitals, medical groups, county, senior services, and the likes of that. Basically, we are in Atlanta, Georgia, but we can operate anywhere. So there you have it.
And the question is, what do you do, and how does it lessen the cost of healthcare? So, how do you suggest?
Me?
Yes,
Okay.
how do you suggest?
Okay. Well, so that's what we do, and how it lessens the cost. This is huge. I'm going to give you an example. Hospitals, we had a particular hospital that was trying to discharge a gentleman, and he lived 100 miles away, and no one would come and get him. And so they had a real situation. They did some research, and here's the research. They could hire a emergency vehicle, an ambulance, to take him home, and the cost was going to be $4,500. They checked the next, they could get a taxi to come and get this gentleman, take him home, and that charge was going to be $1,750. Or sorry. Guess I wasn't supposed to do that. I wanted to make sure you were awake because here's the big line. Or you could call common courtesy, and we could get this gentleman 112 miles away, and the charge was $149.50, basically. So right there, it's sensible, it works, it's easy, it's it's just what we do, and we're so blessed to have evolved this over time.
Thank you so much for answering
Well,
that
you're so,
question.
thank you.
In America, in many countries, because it is very different about healthcare. In America, though, do we view healthcare as a privilege or a right? Or Dr. Dale Holly?
Yeah, I think that's really the question for the day for the country. First of all, thank you all for having me. It's an extreme privilege and honor to be here with you today. But I really think that that really to me is that's kind of the seminal question is healthcare a privilege or a right? I think up until this point, healthcare has been a privilege, and we need to change that. We need to make it a right. And what I mean is the framers of the Constitution basically, when they put the Constitution together, said that we are all endowed with a certain inalienable rights, that being life, liberty, and the pursuit of happiness. You cannot achieve life, liberty, or pursuit of happiness if you don't have your health. And so I think we really need to change how we look at it, the optics of health, and what does that mean? And we need to take it seriously. Every human being should have access to health care, regardless of socioeconomic status, ethnicity, origin. This is really a critical issue for the day. And so I think if we approach it from the standpoint that healthcare is a right and we invest appropriately, we change the dynamic, we change the paradigm, we change outcomes, we improve quality, we obviously provide accessibility, we can make it affordable. We can. It's hard work. Healthcare is difficult. There's a reason that we haven't had universal healthcare because of the challenges and the complexities and the comprehensive way in which we have to approach this makes it really, really challenging. But I believe in ingenuity, innovation, hard work, commitment, compassion, and most importantly, empathy and love for one another. I think if we use those principles, we change the dynamic. We make it a right, and we can change the course of the planet. We really can, because that's what it needs to be. It has to be a right. It has to be a right. That way, we can positively impact society. Because without it, tremendous burden is put on the healthcare system when people don't have access, that it can't afford it. Outcomes are worse. And I think if you look at our system in this country, we're spending 18% of gross domestic product on healthcare. Yet we have a poor delivery system, and our outcomes are some of the worst in the world. So I think we have to ask ourselves, given what we've done thus far, we know that this example that we now have has not worked. So we have to have the courage to change. And it takes courage to change. It takes hard work. It's rethinking how we do something, facing those challenges. But if we do it, we commit to it, I'm convinced. I'm an optimist. I believe we can change the world through healthcare. That's the kind of impact it could have.
Thank you very much. We're going to get a little bit of old school. What is the indigenous medicine and how does it contribute to affordable health care? I'll ask our Dr. Adem Singh.
Thank you. Can y'all hear me?
We can.
So I'm just gonna correct my name because I've for 30 years I've let people say my name incorrectly. So my name is Dr. Udom. I am CEO and founder of Sunny Therapeutics and founder of the Ufanima Institute, which is a nonprofit based in Nigeria and Washington, D.C. I have had the privilege for the last 10 years to see healthcare in different lenses from the American perspective and as an immigrant and a Nigerian from those perspectives. And I agree with everything that you said, Doctor. It is rough, not only as a clinician, but also as someone who participates in the healthcare system. And so the last couple of years, thank you, pandemic, I know some people I am grateful to COVID because I woke up to the ways in which this country still does not live up to quote unquote the American dream. And so my practice, I'm a doctor of physical therapy, but I have incorporated indigenous medicine practices from my country, from China, and from all over the world because that is preventative medicine. That is where we need to return to and what we need to incorporate. And those things were not taught to me in physical therapy school. And so I struggled and I bounced around from hospital to clinic and outpatients and tried to figure out, like, why is this not working? Why are my patients not getting better? Why am I seeing the same return visitors every 6 months like clockwork? It didn't make sense to me. And I'm optimistic and I'm like, yay, America, I'm here, I'm gonna do this thing. And I'm like, oh, it's hard out here. Like it's really, really hard. And I wanted to be the change that I did not see. I didn't see any of those practices. And a lot of the hospitals, we weren't asking, our clients what their religion was or what their sex or what their gender was or how they wanted to be identified. And that is not patient care. You're not getting to know who is sitting and standing in front of you or laying in front of you because you don't know truly who they are and how you can assist them. So for me, indigenous medicine is truly important and it needs to be incorporated in the education system so that we can provide like true preventative care. Indigenous, it's literally knowledge passed down from ancestors and generation to generation. It's the oh, let me get you some Robitussin when you're sick. It's my mom, she used this charcoal, which I can't think of the name right now, when I was younger, my twin brother and I, for eczema, and it cleared us up in 2 months. And so it's things like that, knowledge like that, that we are not really incorporating. And I feel like it needs to be in all sectors, no matter, if you're a physical therapist or a physician or, if you're a if anybody, because knowledge is power. And for me, indigenous medicine and returning to our roots is key for improving and bettering healthcare for all.
Thank you for that. What policy would you change to increase availability and improve the health economics? Mr. Mr. Dr. Dale Hutchinson.
All right. Thank you for the question. It's good morning. It's a pleasure to be here. In order for me to answer that question, I think you need to know a little bit about me. Ultimately, the answer is until we put purpose and people ahead of profit, healthcare is not going to change.
Mhm.
So the reason I say that is I'm a West Point graduate. I spent 25 years in the military. My medical school was in San Francisco during the AIDS crisis. And over those 25 years, I went to different countries. I saw combat. I took care of people, whoever walked through my door. And now I'm working in Austin in a FQHC, a federally qualified health center, taking care of people who have either no insurance or very little insurance. So my whole career has been about taking care of people, and that's been the purpose. And I really do believe that until we face that, until we have more organizations that put people first, healthcare is not going to change. Profit is still going to rule the way. So the policy that I would change, actually, there's so many of them, but the one I think is the lowest hanging fruit. Well, the hardest one is universal health care. And military is socialized medicine. Anybody who comes to be seen can be seen, doesn't matter your rank, your purpose. Anyone in the military is seen. That's socialized medicine. We have to acknowledge that. That's the big one. The small one that we can start attacking, if you want to do it piece by piece, has to do with our drug system. We in the US feel very privileged and entitled to have what we want. But working in the military, I only had so many medicines I could prescribe. There are 5 different proton pump inhibitors, medicines for heartburn. Why do I need 5 options? It's not up to the insurers to decide what medicine should be. It should be up to the providers, whether it is in the hospital or that health system or nationally. That is probably the best policy that I would recommend that could decrease cost if we just eliminate the options and let physicians and healthcare people decide. If we could let pharmacists, when a patient comes up, they see they have a prescription and they say, well, here's a cheaper option for you, let me change it, that would make a huge difference. But instead, physicians, and I'm one of the group, we don't want to give up that power. So we have to decide as a group that if we're going to change the way that we take care of people, we have to put the people first.
Thank you for that. Before we go ahead and do Q&A, I wanted to say a few things. So here I am a speaker, but I'm also a healthcare provider. In my industry, which is mainly hospice and elderly geriatric care, I decided to get my doctor's degree in holistic medicine. But my school was in jeopardy because of the government saying that we who are in holistic medicine are quacks, that we should not be doctors. So I am actually a doctor, but I cannot say that because it was a holistic school. So I would like to ask our panelists, how do you feel about the medium of Chinese medicine, other holistic forms, Ayurvedic, all of that, which would be a part of the affordable healthcare plan, in my opinion. What is your opinion on the topic? So I will go ahead with you
Yeah,
first.
I'll start. I have patients regularly who ask what else can be done. And I'm the first person to admit that Western medicine doesn't know everything. So my philosophy is as long as it causes no harm, because that's the first thing we have to all agree on, do no harm. Does this medicine help you physically, mentally, spiritually? Then I'm fine with it as long as you're still at least conferring with me and asking questions. And as long as you're finding your source and your information from more than one reputable resource.
Thank you. Anyone else would like to comment before Q&A? Oh boy. I see. Go ahead, sir.
Yeah.
Yeah, I would really like to talk about this because I think in gastroenterology, in my field, there's a tremendous amount of psychosocial overlay. If you look at various diseases, whether it be with irritable bowel syndrome or just functional abdominal pain. You look at peptic ulcer disease. If you look at reflux, we know that our mental health is tied to our physical health. So I'm a big believer that when you combine traditional Western medicine, I agree with Jeff. I mean, we don't have all the answers in traditional Western medicine. So I think when you combine that with a holistic approach, I think it's synergistic. I think it's 1 + 1 = 7 or 8 or 9. The number could be even higher. So I think it has tremendous impact and can be really profound. Patients are looking for options. They're looking for other alternatives than just traditional Western medicine. So we have to be open to other options for them and meet them where they are. A lot of people don't want to be on pharmaceuticals, and so as long as as Jeff has said, as long as these medicines are not hurtful to the patient, and I think if you have a patient that's fully engaged, they understand that you're seeing the big picture, you're looking at them holistically. That's what I try to do with all my patients and not just see them from a GI or liver perspective or context. I think it's important to look at them from a holistic context, from head to toe, because their mental health does impact their GI health, and their GI health impacts their mental health. So I'm a firm believer. Holistic medicine has a place. We should continue to respect that and use it in those appropriate situations.
Yes.
I've been waiting patiently. Holistic medicine is what I do. I believe humans, we are very hard-headed. And as a physical therapist, I see people when they're at the end, when their hard-headedness has resulted in the physical manifestations of their trauma, whether emotional, spiritual, mental. And so in my sessions, a lot of the time we're doing coaching and education, and I hear their entire life story about how they ended up where they are. And oftentimes, it could have been avoided had they had the privilege to have access to mental health care, affordable mental health care. In my household, believed in mental health care because we're Nigerian and, we just push through and American dream, we got to be productive. We don't have time to worry about your emotions and how you feel. So that's not something that I grew up with. It took me a long, long time and a lot of deaths that I had to grieve and the pandemic to be like, oh, okay, let me fix this because this is not okay. Like it doesn't make sense that having 2 weeks off of lockdown to clean a clinic was the waking up that I needed to be like, oh, wow, this is what it feels like to actually go to the bathroom and have lunch and eat fruits and vegetables. Oh my goodness. And wake up and get to go work out and dance and just do things I love. Oh, yeah, because I'm not required to go back to back to back to back and see these patients and sacrifice my mental health and therefore my physical health because I was the worst physically. I couldn't get out of bed. I did not want to get out of bed. And by returning to roots, returning to prioritizing mental health and physical health, emotional health, that is where I personally have seen the greatest change. And then sharing that with my friends and family and loved ones and clients, just the impact of me sharing them a tip of what I did to get out of the rut. Indigenous holistic medicine is how we need healthcare to move forward in the future. And I don't see any other way. So
And this, yeah.
Yes. Um, First of all, I'm a cancer survivor, so hooray for me. um, what I I almost think I have a question more than an answer. I certainly don't have an answer, but I do 100% believe in holistic medicine. I believe that surgeons are fantastic, oncologists are everybody. They do a great job with what they do. But I also believe that there are things outside of that and my question is, as let's say a patient, what's the best way to access all of this holistic medicine and all of these wonderful other things that can make me healthier? Do I go through my doctor or do I go just out on my own and start Googling things or whatever? I mean, it's kind of a funny feeling when I really would like to have a holistic doctor alongside my other doctor, but I don't have that now and I don't really know, but I think it should be.
yeah. I'm going to speak to that because that's something that I'm in the works of creating right now is a platform where you can go and you can find your chiropractor, your dentist, your physician, your healer, your whoever, and they all talk, right?
Oh,
And that, you can communicate and find the resources that you need after hours, 24-hour care in that way. Because right now, what I'm finding is my patients will come back to me and they're like, well, my physician said that he doesn't believe in Reiki or he doesn't believe in acupuncture. And what do you think about that? And I'm just like, well, that's a bunch of bullshit. So that's
Ah,
just, I believe that as a healthcare provider, you should be proficient and knowledgeable in all the different ways that people heal. And modern medicine is new. Indigenous medicine has been around for ages. We created the healthcare system in America now. And so creating a platform and a network where we can all collaborate so that you can truly get your checkups of all mental health, spiritual, physical, sexual, all, like that be implemented into our healthcare system.
Thank you for that. So I know there has to be so many questions
mhm.
in this room. So if we could ask one question, and then my suggestion is that after the session, we will have more discussions as we go along in the week. Okay? So, ma'am, you raised your hand first. Could someone please get her a mic really quickly? What is your name? And what is your question?
Um, can you hear me?
Yes, ma'am.
My name's Elise, and my question is for Ann Carr. So I work with people who are recovering from substance use, and there's a lot of times where I encounter people who are getting out of rehab or out of prison who can't get back home.
Right?
So does your nonprofit cover rides for people like that also?
Yes, we do. There's a light, that's why I'm sorry to do that, but I like to look at you, but I can't really see you. But yes, we do. We use our system utilizes Uber and Lyft. Um, the hospitals that we work with primarily, they call in the rides themselves. They do it all themselves, and so that's great. Um, some of the other entities have have us schedule the rides. So it can be the you mentioned prison. I mean, it can be anyone. We are available for everyone. The trick is that what we try to do is lessen the price of the ride share. Um, for the hospitals, we charge the ride share cost, whatever it might be, plus $1 for the let's say county social service senior services departments of transportations that do that. We schedule the rides for them, watch over the ride, where the it's going and getting back, make sure everybody's connected and they get home safely. And for that, it's the ride share cost plus $3. So the charge is not a lot, but the counties can subsidize the rides. The hospitals, through grants and things, can subsidize or pay for the rides. So now we're working to get a community assistance program because a lot of people don't fall under the county senior services or the hospitals. So we're putting together a community assistance program so that we can get some sponsors and get some funds so we can help individuals that are needy and don't fall under that. So we're working toward that now. Um, and I would appreciate it if you all could look us up and see what we're about um, so we can grow, actually. Did
Thank you so
I
much for
answer
your
your question?
question. Oh, and yes, sir. In the back.
Yeah, my name's Dave. It's an interesting exercise to follow the dollar through healthcare, right? And see who siphons off what portion of the profit. You got guys like Mark Cuban out there with his new drug cost plus, lowering the cost of medication. But if we're going to lower the cost throughout the continuum of care, I'd be interested in hearing from the physicians what AI is going to play in that. Maybe I should be in next door. Maybe they're talking about AI and digital over there. But certainly, as I think about big data and AI and all the startups that are happening, um, it is going to have an impact, right? Everything from med school and the way physicians learn to the way they practice medicine to the profits by the for profit organizations. So I'd be interested in your thoughts on that.
So first, there's a warning with AI. AI is not the panacea that's going to make everything better. And AI uses existing data. Our health system, unfortunately, is biased. There's a lot of race-based medicine in our system that causes problems, and AI will use that information to make more recommendations. So as we go forward with AI, we need to be very mindful of what data is used and how it's used. How can AI make a difference? AI can make the best difference when it comes to recommending treatments with the help of a live person, a person who can review it. So if I have a patient has 5 symptoms, I have no idea what it is, AI would be fantastic at saying these are the top 3 that it could be, and I have to decide which one of those I should pursue. So I think AI can have potential. It's not going to change health cost. AI wants to replace our scribes and replace us taking notes. So maybe there will be some jobs that can be eliminated with AI, but that's not where the cost is. The cost is not the people. The cost is the administrations and the people in the mid level who are siphoning off the money, as you said, in order to keep the system running. And AI is not going to change that, in my opinion.
Thank you. So where can we find all of you? We only have 5 more minutes, so we will start with you. Where can we find you if we want to?
Yes, I'm in Atlanta, Georgia. I'm with Practice Single Specialty Group, United Digestive in Atlanta, Georgia. We've got offices all throughout the metro area. We're actually in Florida. We're in Tennessee, excuse me, South Carolina, and also in North Carolina as well. So we have a large platform, but I'm in the metro area. And you can just go onto our website at uniteddigestive.com and take a look at our webpage. And everything is very accessible there. So happy to serve anyone. I've been in practice now over 25 years and still see new patients and and if the schedule allows, I work people in daily. So we're always working, trying to accommodate to make sure availability is first and foremost for us and our patients. So happy to serve and just want to say thank you to uh, Healthcare 2.0 for putting this conference on and thanking you for your time and listening today. And I hope we can continue to have these type of conversations going forward because I think that's what it takes in healthcare. It's going to take a collaborative effort, and that can only take place through really efficient dialogue and respecting one another's points of views. Thank you.
Thank you, Miss Ann
Okay.
Carr.
You can get in touch with Bob and I and our company, Common Courtesy. Um, you can go to CC Rides, RIDES, .org. Um, Also, I think I've got cards. I can give you my mobile number. We'd love to talk to anyone about this. Just so you'll know, we are located in Atlanta, Georgia, but we can operate anywhere Uber and Lyft are in existence. So we can do rides in California, we can do rides anywhere. Um, and we would just love to serve as many people as we can because it is an efficient and beautiful way to have a car come pick someone up, take them where they need to go, get them there, and then bring them back to their home. It's just, and it works. It just works beautifully.
Thank you so much.
Well, thank you.
Where can we find you?
Find me all over the place. Different mediums for different people. If you Google Sunny Therapeutics, you should find me. I'm on Instagram. My Instagram is at doctor_D. You can find me on LinkedIn, Dr. Udom Isang. You can Google that. Or if you feel so inclined, if you want to help build this world and make it better, I believe in collaboration and community. So you can also text me at 302-715-1294 or find me afterwards.
Wonderful. And how do we find you?
I'm in Austin, Texas. I'm an adolescent medicine physician. That means I take care of 11 to 25-year-olds. I don't think anyone in here is quite that age group. Um, that's what I do at the community clinic that I work at. But my other role, my other job is I'm a leadership consultant with a diversity, equity, and inclusion lens. You can find me at wadealliance.com. And I'm happy to start a relationship and help people who have leadership challenges with a diversity, equity, and inclusion lens.
Thank you so much. I am Libya Mitchell. I am from Atlanta, Georgia, but I am also based in Austin, Texas. So we're kind of neighbors. You can find me at Live Speaks. I speak on leadership, healthcare, and resilience, but I'm also a healthcare consultant. So I serve only the hospice world and also the elderly slash geriatric world. It has been our pleasure. As you know, this is a heated topic. I thank you all for not throwing chairs at us. I thank you very much for not going crazy. But it is a heated topic, and it is a topic that we all love and we all want to make better. It has been our pleasure being here for your first session of this conference. Thank you to Health 2.0. This part is adjourned.